Museveni, Her Excellency First Lady Gabon, Zita Nguema, Excellencies, Ministers, everyone, ladies and gentlemen, the media, I wouldn't want to take much of your time. Let me stand on the existing protocol. And I want to plead with you. I left Nigeria on behalf of my First Lady, Honorable Senator Oluremi Tinubu, to come here. And I saw I was given 5 minutes to speak after flying in from this distance. I plead with you, I need a little more time because this is a huge opportunity. I don't want to miss it at all. So I start with my First Lady's speech, then I will speak heart to heart concerning this wonderful opportunity the First Lady of Uganda has given us, and my wonderful sister over there, Ms. Valera, who Africans can miss this. We must grab it seriously. Thank you. So that's my First Lady's speech. I am honored to be invited by the First Lady of Uganda and the Minister of Education and Sports, Her Excellency Honorable Janet Museveni, to participate in the launch of the Women's Optimal Health Framework. This comprehensive research-based resource is a significant milestone in the drive to prioritize the health and well-being of women across the lifespan, from conception to end of life. I congratulate Your Excellency and the people of Uganda for this initiative. At the heart of this framework lies a commitment to community health, sanitation, and hygiene. It is crucial to understand that the health of our communities is linked to the well-being of our women. By promoting healthy lifestyle practices, good national habits, ensuring access to clean water and sanitation facilities, we can prevent the spread of diseases and improve overall health outcomes in our women. I am particularly proud to highlight the strides that Nigeria, with a population of over 200 million people, has made in the realm of healthcare in providing low-cost and high-impact intervention for women's health. Our Universal Health Coverage Initiative has extended healthcare services to even the most remote rural communities, ensuring that no one is left behind. Additionally, the National Health Insurance Authority has revolutionized access to health care by providing affordable and quality health care coverage to millions of Nigerians. This social health insurance program has significantly improved access to healthcare services for women across the country. By providing affordable coverage, the NHIA ensures that women, especially those in rural areas, can access essential medical care without financial barriers. This reduces maternal mortality and morbidity rates and overall improve well-being for women and their families, to promoting equity and inclusivity. Moreover, Nigeria has initiated a transformative process to revitalize 17,600 primary health care centers nationwide, bringing healthcare closer to women and their children and delivering gender-specific and sensitive care. By eliminating out-of-pocket expenses for maternity care, women can access prenatal, delivery, and postnatal services without fear of financial hardship, leading to improved maternal and infant health outcomes. Also, the Office of the First Lady, through the Renewed Hope Initiative, which is driven by my office to complement the efforts of the administration of President Bola Ahmed Tinubu, GCFR, working with the Ministry of Health and Social Welfare, in October 2023, introduced the human papilloma vaccine into the national routine vaccination schedule to stem cases of cervical cancer amongst women. Since then, the Ministry of Health and Social Welfare has vaccinated over 4.7 million girls. In addition to combating the prevalence of syphilis amongst pregnant women, which stands at 0.7%, the country has adopted triple elimination of HIV, viral hepatitis, and syphilis to prevent mother-to-child transmission. Furthermore, the Renewed Hope Initiative secured a grant from an international donor agency to train midwives and frontline healthcare workers to address the increasing cases of maternal mortality and morbidity, as well as strengthening collaborations in the prevention of mother-to-child transmission of HIV/AIDS. It is worthy of note that state ministries of health, under the supervision of Federal Ministry of Health and Social Welfare, provide accurate and easy-to-understand information about women's health issues, focusing on healthy lifestyle choices, avoidance of risky behaviors to prevent non-communicable diseases such as breast cancer, diabetes, hypertension, etc., in women of childbearing age. Advancing improvement in women's health demands a multisectoral and collaborative approach, as poor health indices signify a broad-based deprivation. Understanding this, in 2023, I established the Renewed Hope Initiative to bring about improvements in health, agriculture, education, economic empowerment, and social investment, targeting women and vulnerable groups to bridge the gaps. Acknowledging that good health is vital at every stage in life, I have commissioned several initiatives to support nutritional health with commencement of the Renewed Hope Initiative Women Agricultural Support Program, which targets over 3,000 women across the country. Every home, a garden, competition for women, young farmers club, for public schools to encourage the culture of farming and good nutrition amongst our women and young populace. In conclusion, the Women Optimal Health Framework stands as a testament to our collective commitment and shared priority to ensuring the well-being of women across the globe. With the number of years to go in closing the gender parity gap and an undefined timeline to address the health and survival gender gap, we must come together as we continue this collective journey. Let us forge stronger collaborations, share knowledge and best practices, and enact enabling policies to empower women and strengthen families, fostering a healthier and more prosperous future for all. Once again, I thank the First Leader of Uganda and the Minister of Education and Sport, Honorable Janet Katahi Museveni, for inviting me to be part of today's event. I commend Her Excellency for her leadership and vision in spearheading this initiative. Together, let us strive to create a world where every woman can thrive. Thank you. God bless the Republic of Uganda. This speech is by Her Excellency Senator Oluremi Tinubu, First Lady of Federal Republic of Nigeria. Thank you, everyone. Please, this is time for heart-to-heart talk. This opportunity is wonderful, and I thank the First Lady of Uganda. I am very emotional when it comes to issues of Africa, because I know the Westerners have really tried their best to assist us in so many ways. But I want to plead with them. We don't want to lose out in this opportunity. If we continue the way and manner your helps have been managed in Africa, we will still end up the same way. Because you've been doing so much, but there's not much improvement in the lives of Africans. And you only have peace when we are okay. If we are not okay, there will be no peace for the white men, because we'll keep being a burden on you. So I am pleading, as we in Nigeria are changing things, we are changing the narratives. If you have been doing something over and over again and it's not working, and you are not seeing improvement, any intelligent person will know that it is time to change narratives, change style, reposition yourself a little bit. Let us see if that will work. We could give it a trial. So I am pleading, please, when you come to Africa, and most of the monies you donate to Africa, that you need to help us, are pushed more into advocacies, consultancies, meetings. It doesn't trigger down to the people that need those help. How do we move on? How do we succeed? How do we pick up? That means whatever you are doing will still end up in stories. You come out, you tell the stories, but deep inside your heart, you see you are not seeing the impact. I am pleading for you to follow up on the monies you give to Africans and cut out issues of advocacies, meetings, and consultancies. That is a way to siphon money, and it doesn't go down. I am pleading with you. It's only you that can help Africa to solve this. Then when it comes to we Africans, they say charity begins at home. If you need help, you first help yourself before somebody can help you. So I advise, like we are already doing in Nigeria, through our First Lady and the President of Nigeria on the Renewed Hope Agenda, and through the ministry that I am the Minister, Women Affairs, we are collecting all Nigerian vulnerable and less privileged people. Those vulnerable, we know most of them are very hardworking, but they're frustrated one way or other because of policies and the way things have been going. Now we are collecting them. We have a big portal where we started it about a couple of weeks ago, and we've gotten close to 1 million+ people registered. And they register in the trade that they love to do. In that registration, equally, banks are part of this portal, and banks are subsidizing health insurance for all the women that are hardworking. And the government, President Bola Ahmed Tinubu, is giving them machineries to boost their businesses and reduce the suffering. African women suffer a lot when they are, for them to make any little amount, they suffer so much. So the president is trying to reduce their suffering. If you are into cassava, you'll be given an industrial. They come as a group, we give them an industrial machine to process the cassava and even make the planting of those things easier for them. If you're into anything, we provide you those machines. That makes things easier, and that will enable them to start making money. So in that portal, we have buyers, we have off-takers, we have deliverers, we have advertisers, and those, the farmers. And when you now want to help Nigerians, for instance, you just get involved in that portal, and you see those vulnerable people you want to help, and you can track your money, you can track your help, and make sure it goes to the right direction and where it's supposed to be. So I am pleading with the First Lady of Uganda and other Africans, like we have agreed in the meeting we had in African Union meeting in Addis Ababa and Tanzania, that we are adopting to change the scenario. If anybody gives us loan, you won't come and start dictating to us how we manage the loan. There's no way we can manage it in your way and be able to pay those loans. We want a situation we could manage our loan and speak the language we understand. We talk to ourselves, we talk us, not they talking to us as they, so that we can improve our lives. Africa must move forward. This is a very good time for us to stand firmly on the ground and move our country forward, taking out selfishness, wickedness, and inhumanity to human. That way you will consider others before you consider yourself. So I am pleading, my darling sister, I thank you for this honorable thing you brought here today, and the First Lady that made it possible for us to have all of you here. I thank her so much, but I'm pleading with you. You need to please look in and see the best way this your effort will go down to where you are targeting it to go. And I am pleading with the First Lady to please let all of us partner. We could have that one portal that connects all Africans, where these foreigners, when they want to help us, all they need to do is go through the portal and help us. And you will be seeing that we'll be happier, and you will have peace, and we will have peace. Thank you so much, the First Lady and everyone. May God bless you all. Thank you. Taha Museveni.